All right, welcome back. We do have Dr. Rebecca Yorinde here with us. She's representing APHPN.
Thank you.
Okay, and then we've got Dr. Haggai Wilfred, who is the GM Aeromedical Standards of the NCAA. Thank you both for coming on this morning.
Good morning. Thank you for having us.
Well, this is something of huge importance globally, as a matter of fact. But if both of you could start by telling us, what kind of consciousness exists in your workspace or your work environment about this coronavirus?
Thank you very much. Coronavirus, or the nCoV, which is a 2019 novel coronavirus, since the identification and the confirmation of the virus, which is closely related to SARS and MERS. It's a respiratory tract infection, and it has no cure for now. It's a new virus, and so it calls for alarm. Everybody is concerned about what to do, and the preparedness is also on ground. Now, in my local space now, as a public health physician, we're thinking of how do we get people on board with us? How do they think about what we're thinking about? Because the transmission is through aerosol. It's through the space of the hair. It's not like Lassa fever or Ebola you need to touch. This can be contracted. So this is the magnitude of the public health emergency that we're thinking about. So it's something of great concern to us. And now, because it's in over 16 countries now, and over 250 or so are already confirmed cases, and we know that it's a zoonotic disease. It was gotten from a seafood market in Wuhan, in China. So what are we thinking about? We're thinking about, curbing the diseases. We're thinking about preventing it from also being imported to Nigeria. And now we also know that we have pockets of Chinese environment in Nigeria. What do we do to prevent ourselves, to also prevent them as they come in, because we can't stop them from coming in. We can't stop travel and trade because it's not yet declared. How do you help ourselves, help the system? And those are the things we're concerned about currently.
Thank you very much for having me on this program. The Nigerian Civil Aviation Authority is the regulatory body for aviation industry. We have annexes of the Chicago Convention of the International Civil Aviation Organization, which is made into our local laws. Annex 9 of the Chicago Convention stipulates facilitation in terms of public health emergencies and also implementation of the IHR 2005, the international regulations. In the NCA, we operate a system whereby we issue advisory circulars. On the 23rd of January 2020, the Acting Director General of the NCA, Captain Abdullahi Meikano, CD, issued a circular to operators. These operators in the industry, we're talking about the airports, we're talking about the airlines, we're talking about the air service navigation providers, which is like Nigerian Airspace Management Agency. In this circular, he advised high level of vigilance to be maintained by the airlines, also by the airport operators, and also by the air navigation service provider, which is NAMA, and also the traveling public. This circular was to remind them of the responsibilities enshrined in law that they need to carry out. We just heard from the Minister of Health that pilot in command of aircraft, where a case is suspected, should report the case to the air traffic controller. There is a chain of communication at the airports, and the air traffic controllers are supposed to, as priority, notify the port health services of that aerodrome they are going to. If it is coming in, that means they have time to get ready to be able to receive the aircraft. Also, it is required that if they are coming in, and that case is detected, by law, they are supposed to fill in what is called the general declaration, the aircraft general declaration, is to be filled by the crew. That means that they will take the names of the crew members, the index case, and also document it and the temperature.
But it's a little tricky now because if, assuming,
yes,
you know, there was a confirmed or suspected case and they do report and the person must have sneezed or coughed.
Yes,
that kind of environment.
I'll comment to that.
Please go ahead.
There's another form they are going to fill. It's called the personal locator form.
Personal locator form?
Form, yeah, which is a form filled by those who are sitting 2 rows to the left, 2 rows behind, and 2 rows in the front. So those around that index case will fill that form. And that form is to be given to the Port Health for contact tracing. And with ongoing discussions, we are going to have what is called the health declaration form. This health declaration form will be filled by all passengers coming in, if the Ministry of Health determines that is going to be done. That form will be filled by everybody coming on that flight to give us their details, their addresses, telephone numbers, to ensure easy contact tracing. So that is what is being done at the airport level.
Now, just to understand the magnitude of this coronavirus, which you call novel, it appears as though there's still a lot to learn from it. I mean, looking around, about 170 deaths in China mainly, but you see that there have been confirmed cases in 20 countries around the world and over 7,000 cases confirmed, as you can see. So it's interesting that this is kind of gaining momentum, sadly, all across the world, and the worry keeps rising, and we're trying to just send out the right information. So if you can help us, walk us through the process. So you've told us what the pilot needs to do when a case is perhaps suspected on the airplane. Walk us through. So once the person gets into Nigeria, at the port of entry, what is the process of, quarantine? You can see the figures right there. So the process of, the quarantine process, monitoring, the whole gamut. Can you walk us through this?
Thank you very much. We have gained momentum, and we've learned from the Ebola virus disease of 2014. And after that, we had discussions, collaborative discussions at the airport level, spearheaded by the Port Health Services, the Nigerian Center for Disease Control, supported by agencies like the Pro Health International and other agencies, WHO and the rest. And at this port of entry, the international port of entries, we were able to develop what we call the public health emergency contingency plans. And these plans are specific for aerodromes and for airports that are internationally, they operate international scheduled flights. In the plans, they have a chain of communication of what we need to do when there is a case detected, whether arriving, whether departing. The plan is explicit, and the plan has been tested over time. We've done full-fledged mock drills. We have done tabletop exercises at the different airports to simulate any case. We had a case where we simulated between the Pro Health International, the NCA, and the agency, the foundation for Dr. Stella Adedebo. We had this simulation done last year, and it was that we sent a young lady, not known to Port Health, not known to FAN, to Ghana. And she flew in and was to test the ability of the airport or the Port Health Service to detect that she is coming in with a problem. She had a handkerchief that was blood-stained. She gave a history of being in contact with a family who died of Lassa fever, and to simulate the activity. And we now did a hot debrief after that, and then a cold debrief thereafter. So we, at the level of the airport, there are flowcharts in that plan. The plan is embedded in the aerodrome emergency plan of the airport, for each airport. And these plans are specific. They have what each agency needs to do. We talk about the 4 Cs. The 4 Cs are the coordination, cooperation, collaboration, and the comprehension of the disease condition. And this is explicit in the plan. The plans have been tested, they've been validated.
And all the agencies are aware of what they do?
The agencies are aware, and once you activate the plan, you have a meeting to activate the plan.
Okay.
These meetings are ongoing.
The concern, another concern that has been raised since this whole thing began, madam, is that of the capacity of the health workers some have raised issues about the training or lack of for these people, given that even the health workers, not just the carriers or the people, are also vulnerable. What kind of training do we have for health workers to take on this novel, unknown health concern?
Thank you very much. I won't say there's lack of training, actually, because the lessons learned from the Ebola viral disease response is sure and enough for us to attack any emergency coming our way in Nigeria. We have the health systems on ground. We have the reporting systems on ground. Now, what we need to do is retraining. What we need to do is to simulate. What we need to do is to build on what we have on ground. Now, we don't need to sit down and just forget and put all the lessons learned during Ebola under our carpet. We need to reactivate all the strategies that we used during the time. And that is what we are doing now. And that is what APHPN is advocating to the government. You remember,
sorry,
Lagos
Madam,
State.
The concern is not whether or not there is training,
Yes.
or as Dr. Wilfred has also said. It's that you said, and everyone has agreed, it's novel. You said also it's airborne. And some even say that the fact that this thing exists doesn't mean that, because even though it's airborne, you use a muffler, it doesn't ascertain that it's protected or all of that. Anyway, you'll be able to please answer that question when we return from this break. So please stay with us. Thank you for staying with us, Dr. Ayorin. We wanted you to respond to that the other time. It's airborne, yes, unlike Ebola, as you said the other time. So what level of preparedness or knowledge do the health workers have because they are as vulnerable as the passengers?
Thank you very much. The nCoV, or the novel coronavirus, has symptoms so similar to a typical respiratory tract infection, similar to pneumonia, similar to SARS or MERS. So we have the symptoms they are not far-fetched. The symptoms are like cough, difficulty in breathing, and fever. And so what we have on ground now is the infection prevention control protocols and guidelines. So what we need to do more is to activate what we are doing before, or what we've been doing before, with respect to emergency response. Now, the three classical symptoms that I mentioned, they are the case definition. Anytime you see this, respond appropriately, and even have a high index of suspicion. Treat everyone like a suspected contact. So that is what we are, as the public health physician, we are trying to tell everyone at the point of entry at health facility. We've heard about the point of entry at the aviation sector. How about the land and the seaports? How about our health facilities at the different levels of care? The primary, the tertiary, the people going to they go to the chemist, they attend to them there. What are the level of preparedness? And so it shouldn't limit to only doctors or health workers in the health facility. It should also go beyond that into the community. Okay. And so what the public health physicians are saying is that, well, it is good to treat, but prevention is better. And so we want to heighten community sensitization, advocacy. We want to go down to the level of the community to even know what it means when you're coughing. Of course, we know TB is there, and everybody is aware that anybody that coughs around you, there's a level of notification for TB all around. So we can leverage. What we're doing is leveraging on existing structures on ground, and now bringing up to full the guidelines or protocols with respect to coronavirus now.
One of the things that we have also been told, Dr. Wilfred, is that you could have this infection and not know it. Yes. And we hear that a patient could have it for 2 weeks and the symptoms are not showing. How do people prevent themselves?
Thank you very much. It's a very good question, and it calls for concern because the incubation period, as you said, is about 2 weeks, and that means you can be a carrier, and yet the saying in China is that you could also actually be infective. That is being discussed. It brings to question that the screening processes may not easily detect the cases. That is why Dr. Rebecca has said people should self-report themselves. It calls on everybody, the traveling public, also to know that they may not exhibit symptoms that will be picked up at the points of entry. Once you have a travel history to a point, a destination where it's endemic, and you return and you have a fever, you have cough, you have sneezing bouts, then you need to go and self-report. And also, we call on the vigilance of other travelers to be able to notify the crew members on board or notify the port health services that somebody we've noticed is coughing. Because some might want to actually not show that they are having a problem. So definitely the issue about it not being detected on time is there. So it calls on everybody, the traveling public, to self-report themselves, and those who also are around with them to report cases to the authorities.
Well, the minister did, Minister of Health,
Yes.
in that advisory, he did advise that, well, people coming back from China should perhaps, if they have any such symptoms, stay indoors for about 2 weeks.
2 weeks, yeah.
And then if you notice any
Same
of the
isolation,
symptoms,
yeah.
cold, catarrh, then if symptoms develop, you can then report. But is the NCAA or any agency working with any figure in terms of how many Nigerian students are in China, how many of them are coming back? Do you have any list whatsoever of people who are there who you expect back and things like that? Any such document or information?
Well, that document will not be easily available, but at the point of entry, which is, most travelers these days will come in through the airports. There is a documentation of airlines, and the manifest will show the number of people coming in. This manifest will be collected, and as I said earlier on, the health declaration forms will be developed in due time and shared out. That is where we start having the data taken, because data will now be based on the arriving aircraft. Like, okay, let's take, for example, we have 4 cases now in the United Arab Emirates. So any aircraft coming in from that destination will be given priority screening for the passengers because it's coming from a place where there are an ongoing transmission. So we will prioritize it based on that kind of risk assessment to know where it's coming from. But the details may not be easily available. That's the number of students and also the number of, we've seen on social media 30,000 Chinese workers returning from the Lunar Festival.
But that's not confirmed.
But that's not confirmed. That's what I'm saying.
But do you have a projection as to the probability of this coming into Nigeria? Are you working with the projection of probability?
You know, if you look at the transmission process, you find out that it was localized in Asia, but now it's going to Canada, it's going to Australia, it's going to USA, and then it's come to the Middle East. That is United Arab Emirates. So we are at high alert because the United Arab Emirates is a hub, and that is it is a hub for travelers and business. That means people meet and people move around and people go to various destinations. So we are at high alert because that is, the United Arab Emirates gives us the closeness, 8 hours or so, to Nigeria. So it means that our suspicion level, our risk assessment should be heightened to the highest level because of that incident.
All right, Batu, thank you both for coming on this morning. Dr. Haggai Wilfred is the GM, Aeromedical Standards for the NCAA. And then we also do have Dr. Rebecca Ayorinde, who is of the Association of Public Health Physicians. Thank you for coming on this morning.
Thank you very much.
All right, we'll be back in a moment and focus on the separate matter entirely. Stay with us.